Hello everyone! Brechen. It's time for another Yiddish lesson. So, I remember going to the doctor as a Yiddish-speaking kid and feeling quite confused. The doctor would speak to my mother in English and I wouldn't understand. And if she would need to ask me if my head or tummy hurts, she would say to my mom and then have my mom translate it for me. The best experience I had was when a nurse would pick up a couple of Yiddish words from working in a Jewish medical center and could ask me directly where I was in pain. And so today I will be sharing basic medical vocabulary in Yiddish. Here we go! Wie titt dir וויי? Wie titt dir וויי? Where does it hurt you? For any healthcare worker, this is the most essential phrase you'll need when dealing with Yiddish-speaking children. They could answer you one of the following. Mein Kopf titt וויי. Mein Kopf titt וויי. My head hurts. Mein bouch titt וויי. Mein bouch titt וויי. My tummy hurts. Mein haltz titt וויי. Mein haltz titt וויי. My throat hurts. And now more symptoms. Heesen. Heesen. Coughing. Rinnedige nose. Rinnedige nose. Runny nose. Feeber. Feeber. Fever. Ibel. Ibel. Nausea. Is die shver tzee utemin? Is dir shver tzee utemin? Do you have difficulties breathing? Far wie lang gait des un? Far wie lang gait des un? For how long has this been going on? Gai arouf aufn tish. Gai arouf aufn tish. Hop onto the table. Shtell dich aufn וויי. Shtell dich aufn וויי. Step onto the scale. Steck aroos dan sing. Steck aroos dan sing. Stick out your tongue. Utem aran tief. Utem aran tief. Inhale deep. Hast die Allergien? Do you have any allergies? Now, once the examination is passed, here are some conclusions. Die brauchst, you'll need medicine, sich opzurieren, to rest, a blit probieren, a blood test, although most people are more familiar with the English word nowadays than the Yiddish one, and will probably just substitute it, like, ich nehm a blood test, I am taking a blood test. Die Geist müssen sehen a specialist, or mimche. You're going to have to see a specialist. Although, just like with blit probieren, most people will use the word specialist and not the Yiddish words. You'll just have die Geist müssen sehen a specialist. As for the Yiddish words, specialist is the original Germanic-based word for specialist that Yiddish originally got, but mimche has been integrated from Hebrew. None of them are very frequently used nowadays. That's it for today! Let me know in the comments if you'd like a part 2 of medical terms so all you hardworking doctors and nurses in Yiddish-speaking counties can communicate better with your patients. Tak voor die dag, lihitraat, tschüss en auf Wiedersehen!